One of the questions that is commonly asked is, what's the typical recovery period? Well, every man's a lot different, but the typical recovery period nationwide on average for a penile implant is about 4 to 6 weeks. But if you have surgery with a board-certified urologist who has a special interest in male sexual medicine, who does a high volume of penile implants, the recovery period is about 2 weeks. So following your surgery, we will discuss an individualized recovery plan, and it's important that you follow the recommendations that I give you after procedure to ensure the best outcome and the most comfortable recovery. One of the questions that is often asked by men for obvious reasons is, hey doc, when can I use my penile implant? Well, most patients are able to begin the inflation-deflation process and resume sexual activity, between 4 to 6 weeks on average nationwide. But if you find a high-volume implanter like myself, that number really is more closer to 2 weeks. But every person heals and recovers at their own pace. And so I'm going to work with you to determine when I'm going to clear you to begin using the implant. It's important not to inflate your device and to avoid sexual activity prior to clearance being provided by me. During a post-procedure visit, you will be given very specific instructions and other resources to help you get to know your device and get familiar with it, including information on how to properly inflate and deflate the device. It's recommended that you limit your activity at the beginning of your recovery time after penile implantation. Activities such as taking short walks and going up and down a flight of stairs, they're fine, but avoid heavy lifting or strenuous activity until I give you clearance. You can start to take showers 24 to 48 hours after surgery, and at that time, you obviously have to take your bandage off from the incision after the procedure. And at that time, you can wash the incision gently with some mild, soapy, warm water, and then pat gently to dry. But I want you to avoid any baths or hot tubs or pools. Basically, do not submerge the incision underneath water until I give you the okay to do so. With any surgical procedure, it's very common that you might experience a slight discomfort, pain, swelling, maybe some oozing from the incision site after your penile implantation surgery. However, you should contact me if you have any severe pain, swelling, redness, discoloration of the penis or scrotum, anything that seems to be outside of what we have discussed preoperatively. You should also contact me if you have a fever, significant drainage, or any signs of infection.